Hello, everyone, and welcome to Edge Talk Radio. My name is Angela Zabel. That's me. Today, we're going to be talking about health reimagined with AI with longevity founder, health founder Hunter Ziesing from California. And who am I? My name is Angela Zabel. I have connected to spirit, working with the team in the non-physical my entire life, sharing messages from a multitude of realms. I am a teacher, coach, medium, radio show host, retreat host, gallery reader, and writer, speaker, and I offer guidance, mediumship, intuitive sessions, classes, and the Amplified Universe membership. This is a membership growing our connection to us, our world, our role in it, and how we can move ourselves forward. You can find out more about me at angelazabel.com and pretty much all of the social media aspects out there. And today, I'm going to try to get this set up here. Uh, let's see. I think that's pretty good. Today we are here with Edge Magazine. Edge Magazine is the leading events and media resource dedicated to all aspects of holistic living, health, wellness, and the mysteries beyond, sharing information, wisdom, and resources committed to promoting businesses, organizations, and individuals who support a collective journey to wholeness and balance. It's currently distributed in 30 states plus Canada, with over 17,000 magazines per printing and a vibrant online magazine with over 42,000 people reached per month. Have the magazine shipped to your door, stay up to date with the newsletter, become a drop spot, and check out Kelly Wagner on The Being Curious Show. And you can find out more about Edge Magazine at edgemagazine.net. And today we are here with Hunter Ziesing, and he is truly excited about the movement toward accessible, preventable healthcare and how technology will fundamentally shift on how people can interact with their well-being. His journey has been deeply personal after losing his father and close friends to preventable illnesses, and he had left a long-standing finance career to make a real impact in health, founding Longevity Health, and with that mission at heart, his work leverages cutting-edge diagnostics and building the first $10 a month longevity AI that could soon make healthcare proactive and available to everyone who needs it. He's also welcomes the chance to share these ideas with actionable steps, along with insights from building the Charity of Choice Foundation, which even drew John Kerry as a backer. And AI will be the center of everyone's future health, and that I know it is going forward at such a rapid speed. You can make sure to find out more about him at longevityhealth.me and also on LinkedIn. And there's also different videos, and a lot of those links will be down below, so don't worry about that. And today, Hunter, thank you so much for being here. I want to ask you, what inspired you to leave the finance and dedicate yourself to transforming healthcare?
Thanks so much for having me on, Angel. I had a long career on Wall Street, almost 20 years. And in my early 40s, and I was always an athlete, healthy. I enjoyed helping people find health religion, mostly through cycling and endurance running and diet. And sadly, as you mentioned, I lost my dad at age 67 to pancreatic cancer, and which partially was detectable. And they could have nailed it before it got from the head and shoulders into the full pancreas. And five of my friends under the age 40 had various infectious diseases, not all preventable, but somewhat preventable. I've always been a sort of a health nut. I've always been a data nut. So I just walked out of my Wall Street job one day and I started the Charity of Choice Foundation and partnered with Livestrong. You remember the yellow bracelets?
Yes, I do.
Um, Lance was a fixture in my office because the lead of my investment bank was the founder of the U.S. Discovery and U.S. Postal team, the
Oh,
team that Lance went on to win 5 Tour de France's. He's been dethroned since then, but in my mind, he was a spectacular individual and did amazing things for cancer survivors. Very, there are very few useful tools for survivors. That's what Livestrong was. Our foundation was primarily focused on cancer research and prevention. So we raised money, put on cycling events all over the country with in conjunction with Livestrong with the cancer centers. I did that for about 14 or 15 years, and then I went on to work for a really cool company called Paceline.
hmm.
Paceline is a company that you wear a wearable device, a watch, Apple Watch, a Garmin, or a Fitbit, and it tracks your heart rate.
Yeah.
And each week, you elevate your heart rate above your resting rate for 150 accumulative minutes. You would get
Oh,
rewards. And then you would hit a streak each week, and then you would do it again the following week. And we would pay people as little as $1 a week to hit their 150 minutes. And
well,
it was fascinating what we learned from that experience. Was one that people will work out when they have some incentive, social incentive or financial incentive. If it was Sunday afternoon and you were at 130 minutes and you wanted to get to your 150 minutes, you would run out the dog door and walk the dog and get your heart rate up a little bit. And coincidentally, the American Heart Association and World Health recommends 150 minutes of elevated heart rate each week.
I
Um,
wonder where they got that from.
yeah. You take that in a healthy diet, that's probably all you need. You can throw out all this testing and longevity and conversation's over, you know. Um, but there's a real problem in America. One of the things that we learned at Paceline was that it was the healthy people that were already healthy that were working out more. The unhealthy people were not. And not to pick on Detroit, but we tested it in Detroit and then all over the country. And in New York and California, everybody was using it, and we did a lot of marketing and advertising in Detroit, and we couldn't seem to move Motown. That was our theme, move Motown. So the so what I discovered from that is, one, you need a lot more data than heart rate, and you need to do things to change behavior, which we can get to later in the conversation. But that's a long, long answer to how I got into this business. I started a company called Health Hub, which combined your HIPAA health records
Oh,
with your
yes.
wearable products. And my goal there was to combine that data to make health recommendations. But I quickly learned that you really need more longitudinal data in order to make informed health decisions. And I teamed up with my partner, Jesse Levy from Longevity Health, and commercial for the company. It's longevityhealth.me in case any of your followers want uh, uh, to take a look at it during the call. And we formed a high-end clinic that does a variety of tests and then makes recommendations. Sort of like a bricks and mortar clinic, but it's all virtual.
Interesting. So all the testing is virtual with that clinic also?
Correct. So it's the our main product's called the Billionaire Bundle. No one seems to like billionaires today, but the concept is to give every individual what a billionaire gets. It's not cheap. It's $11,000 a year. We do an initial consultation with a physician. So we're HIPAA compliant. We have three medical doctors on staff. One is a co-founder, a clinician, a dietitian, and an exercise physiologist. And then we do comprehensive testing, including blood work, a DEXA scan, which is bone density. I recommend any woman over 40 or man get a bone density test. It also it's like a cheaper version of an MRI, and it shows your visceral fat and where it is in your body. And I was surprised being an athlete that I had a high visceral fat content. We do a blood test with over 60 biomarkers. We do a sleep study. We give everybody a glucose monitor for a month or two.
Oh,
And
interesting.
uh, we also do a gut biome test. In some cases, our patients will do additional testing, such as MRI or genomics testing. And we're starting to look at DNA. And
Mhm.
we analyze all that data, and it's Angel's data. It's not Hunter's data. It's your data. It's private data, except our team looks at it. And then we develop a plan and we follow you throughout that plan. And then we retest every quarter. Not all the tests, but most of the tests we redo every quarter. It's all part of the $11,000. If you're Slack proficient, we give everybody a Slack channel. And we're kind of in your face and you're in our face for the better part of a year. And then hopefully you renew. And we move the tests around periodically, depending on what tests are trending or what tests are specific to something in your objectives. Um, and we've had incredible clinical outcomes with that. We've changed behavior. Unlike, you go to your doctor every year and it says, Angel, lay off the biscuits and I noticed you just traveled for a month and you weren't eating very well and your visceral fat's up. Here's what you need to do. And then for 6 weeks you do it, and then a year later you go to the doctor and nothing happens. So the concept is getting people staying in front of people on their health regimen based on their objectives. So again, not cheap, but it's been very, very successful. Bricks and mortar clinics cost up to $200,000 if you want to go see Peter Attia, who's got a waiting list. Or realistically, it's $20 to $30,000 for a bricks and mortar clinic. And that's where you go in and they wine and dine you and do all these tests. You're there for a day and a half, and um, they kind of send you on your way, and there's not that much follow-up.
And that's the biggest thing. You talked about Slack. So for some people, could you explain Slack a little bit? Because some people may not know what that is.
Slack is the channel that most businesses now use to communicate with one another. So we have 12 people on our team. That's the way we communicate. It's like a private network to communicate, and you can create all these channels within the Slack channel. But we actually have adopted it to use it for our doctors, clinicians, and dietitians and exercise physiologists, where you can ping them 24 hours a day. Versus right now, I use UCS Health, UCSF, San Francisco Health. I can ping my doctor, but it's like 24 hours for them to get back to me, and I only have one doctor. With a Slack channel, you can just be, it's like WhatsApp or it's like texting. And then
Right, right.
our patients use that. Some use email, some use text.
Interesting. And that's because I know some people don't understand what Slack is. It's basically so you have a coaches at your fingertips all the time, pretty much 24/7, correct?
Correct. Correct.
And that's the biggest thing is to know because a lot of times and I'm hearing my team say it, a lot of times things don't happen on the yearly basis. Things happen throughout the year. And to have someone to be able to talk to throughout the year, that's something important. And that's something different that they're missing on, like you said, you go to a yearly doctor, you see him once, and then the next year you see him again for a few minutes, and that's about it. And it
Mhm.
doesn't go any further. And you also talked about bone density. So for those who maybe haven't had a bone density test, how does that work when you're virtual? Because a lot of people are thinking, how do you do a virtual bone
Oh,
density? Or
great
how?
question. So we have testing partners all over the country. Blood testing companies, um, um, DEXA scan, MRI. So we schedule the appointments for you through the service.
Okay. And that's what like it's like so how does that work when people because if you're doing a lot of things virtual but you have to have some of these tests done, how does that work in that aspect? And I just want to go back to something you had said before. You call it the billionaires. What did you
Bundle.
call it? The
Billionaire
billionaire
bundle.
bundle.
Yeah.
Billionaire bundle. And that's one of the things is and as this is just something from my team, they just want to bring in real quick. A lot of people vilify a billionaire because they're making a lot of money, but actually we are all supposed to be doing our best and doing and being able to make as much money as we can. So don't vilify what you want to be at some point.
Yeah.
So
Well, I fight with my partner over that name. Name change pending.
name
But
change spending.
But the important note is this is all out of pocket. Consumers are taking more and more steps to pay for out of pocket
Yes.
testing for longevity and to get in front of things. Unfortunately, it's not $11,000 is a lot of money. It's delivering incredible clinical results. And we're growing that business. And then our next plan is to make it accessible and affordable to everybody, as you mentioned earlier, is for as little as $10 a month. You'll still pay for tests, but as we grow to hundreds of millions of users, we will be able to partner with the testing companies. And there's many great ones out there. Function Health is one of the best blood test companies on the market. It's like $300 or $400 to get a blood test done. Um, as I mentioned, Dexcom is our DEXA scan company. And as we get larger and larger, we can get bulk discounts and pass those discounts on to consumers. And if we really develop this app properly, and we have all of your data, you own all your own data. We see
Right.
it. It's private. It's on an AWS server. We analyze it. We give you recommendations. But if you walk into your employer today, if you work for a big company, every company's got different plans. Like you can get a free Aura ring or a free gym pass membership. And hey, go work out, Angel, and you're taken care of. But we can take your data and make real recommendations based on your biological profile. That's really important. And then hopefully you can go to your insurance carrier or your employer and get your HSA account to pay for your specific tests. You may not need to go to a gym, or you don't want to go to a gym, but you might have some other condition you need to focus on. So that's the idea, is to take your personal data that's specific to you and make recommendations. But again, all out of pocket right now, that's a challenge.
And that is a challenge right now. But I think you had one thing you had mentioned was the blood tests. And I know there's the regular blood tests, but then there's the in-depth blood tests. And when you do because yours is more of the in-depth blood tests, why is that? Can you explain kind of the difference between that and a regular blood test you maybe get at the doctor's office?
Well, I haven't done one at the doctor's office. I've done one with Life Force, one of our competitors and potential partners. I did one with Function Health, and I did one with Quest recently through our company because I'm going through the program now. Every blood test can measure different biomarkers. We measure 60. I can pull up a chart of my blood tests. So we pick the biomarkers that we think are the most common and needed. We can add additional biomarkers. Function Health does over 150 biomarkers, and I'm not sure what Life Force does in their testing, but our doctors and our physicians are picking the ones that we think are the most needed. So, and it's more expensive if you want to do 150 or 200 biomarkers, you are getting into you could spend $3,000 on a blood test. So
Right. And that's something to just understand. There are so many different levels to all of this. And as you continue to go through, I love how you went through getting the data, putting things together, finding what biomarkers make sense. But also, I want to kind of go back to when you said there's different parts of the country where they seem to be more open to having some of the healthy habits. And one of them, did you ever find the difference or why Detroit was different than other areas, or did you find something to help make people s- take that next step?
I just think it's geographical. Florida, the Northeast, California just tends to be a little bit more health driven. Then sorry to poke on the Midwest. I know you live in the Midwest. You eat a lot of corn, right?
A lot of corn.
Corn fed, as we used to say. Um, but that doesn't mean people don't want to have better health. And I just think people don't have the tools for it and they don't have the data. And I can get into the medical care system, which is just kind of screwed up. I was just over in Italy for a week and I was impressed about how healthy everybody looked and how thin they were. And part of that is most of the food is grown locally, sourced locally. I think there's over 4,000 additives um, allowable in the EUC for processed foods. There's 23,000 in the US. Doesn't mean they're all bad, but the wine you're drinking over in Italy has fewer preservatives. So, the challenge in the US is the food supply. Um, the food companies are killing us. The drug companies are profiting off of us, and the insurance companies make more money on, particularly in Medicare, with end of life care than they do with sick patients than they do healthy patients. They opt in, and your doctors are wonderful, but they have their actuarial tables and their insurance reimbursement, so they can generally only prescribe or have incentive to prescribe functional tests that they get paid for. A lot of this stuff is not reimbursable by insurance companies. And, I know our friend in the White House, Donald, and is controversial, and RFK is also controversial. But one of the things that I support with RFK is changing the nature of our food supply.
Yeah.
I think that's significant. I just went and got uh, s- I went online and I have allergies.
Okay.
I nasal allergies. I've had them my whole life, and I'm only addressing it now because I've been paying for braces in college tuition for the last 10 years for kids, right? Um, so I go in and I went on ChatGPT. I did a lot of research and figured out I really needed a skin test. So I made an appointment. It took me 6 weeks to get the appointment for the skin test. 20 minutes of onboarding, 20 minutes with the doctor, hour and a half round trip. And they
Oh,
said, great, you need to come back for a skin test. I'm like, well, why don't you do it right now? It says, well, Medicare won't pay for your skin test unless you come back for a second appointment. You know, and that's just redundancy and waste, right? It's the first thing I'm going to say to RFK when I see him, hopefully in October. You're wasting money. Um, so sorry, I got off on a tangent. I was really
I like
want to say is people just don't have accessibility to their own data because it's expensive
that.
tests that they should be getting. They don't have motivation. They don't have the know-how. So our goal is to build an engine that enables consumers to access more affordable data And then we use that data to make recommendations.
That's something so cute. So it's very pertinent right now is getting that information to the people because there's a lot of information that may be in our records, but we have no clue what it is because it's a lot of times hard to access that for yourself. And I like the fact that they are changing a lot of things. And I'm seeing a bigger push here where I am too in the Midwest, where people are really being cognizant of what are the foods I'm eating? Where is it coming from? What's in those foods? And how do we change that? How do we make it better? And I'm seeing a lot of people I talk with people all around the world, and I'm seeing that push coming not just here, but actually all around the world where people are really being cognizant of what is in their food and how they can make better choices. And I think that's the bigger thing is how do we make better choices with what's in front of us? Like you said, not all additives are bad, but other ones maybe aren't the best for us.
Yeah,
So
but
we need
it's very hard to walk into a store and read the labels and really have the know-how. And that's something we're going to be doing with AI. And now I'm going way down the road here. On our app, I want to have a check engine light. So when
Mm,
things are going wrong, it gives you a warning. And everybody from age 20 to my age knows what a check engine light is, right? And then
yes.
I want to build in two things, social determinants of health, but also sort of like a finder feature. So if you're driving down the road and you're thinking about, going to the grocery store, first of all, it'll remind you to skip the fast food restaurant and it'll source better restaurants for you that are affordable. Or you walk into, a grocery store and it knows where you are with geo-targeting and it knows your profile, it knows your diet, it knows what you eat. And it says, hey, Angel, here's a diet plan for you today. Check
Mm,
out aisle three. Procter and Gamble is offering, 30% off this or that healthy product. And then the social
interesting.
determinants of health is to build in things that are very much like Facebook, Instagram, where you can build groups of people that are sort of doing things in concert with each other to get healthy. Women's osteoporosis club, women's walking club, men's prostate cancer club, and create a conversation around health to help each other.
I think that's something really important. Like you said, okay, people have osteoporosis, they have cancers, they're maybe moved through that, but they want to keep up to date or keep themselves in the know and making sure they're making the right decisions. That's something important because a lot of times people are like, okay, you have cancer, and then there's not the support, and you have osteoporosis. Or I talk to different women where they're like, yeah, they're telling me I have this, but there's no group support talking to other people and going, what are you doing, how to do it, and having that emotional support, I think is important going forward. That's something that's really missing with a lot of the healthcare because you look at how many people, and people where they died and they had different health issues that were affecting them, and even people who are going through health issues, where's the support team besides the friend? Oh, you can talk to about it, but what about the people who are already dealing with it? What are the people who are already in that mix? I think that's an important aspect that people are missing that I think you are kind of on the cusp of doing.
So, if we have time and you're able to pause, I'll grab my phone and I'll show you our AI and agent. You can talk to it as a support mechanism. It remembers your conversation, anything you told it. It develops a plan for you, and that's what we're
And
building right now. I'd love to show that to you if we have
yeah,
time.
absolutely. Do you need me to do a screen share with you also, or?
No, no, I can just if you are you able to pause for a second while I grab my phone?
Okay, I'll do that.
Okay, I'll be right back. Whenever you're ready.
We're ready. We're going.
Okay, so I'm calling our AI doctor right now. Hopefully it'll.
Hello, this is Jesse from.
Oh, hang on.
Very, very cool.
It just paused. It's still wonky. We're in development. Let me call it back. Hold on one second.
Hello, this is Jesse from Longevity Health. How have things been going for you?
Pretty good. I just got my blood tests and my DEXA scan, and I'm kind of ready to take some action on some of the things that came out of it, including my vitamin D deficiency. My testosterone was a little bit low, and my LDL was a little bit high. So I'm kind of ready to get going.
Great to hear you're ready to take action. I remember from our last chat that we were focusing on integrating those test results into your plan. I've been analyzing the documents you uploaded to Healthy, and there are some results we can discuss if you're interested. We can start by going over your medical updates, then dive into any progress or challenges you've faced since our last conversation, and finally, we can tweak parts of your plan if needed. How does that sound to you?
That sounds awesome.
All right, let's dive into your medical updates. From your blood test, I noticed a few things. First, your vitamin D levels are low, which is something we can address with supplements or dietary changes. Have you been experiencing any symptoms like fatigue or muscle weakness that might be related to this deficiency?
A little bit of upper body muscle weakness.
That could definitely be linked to the vitamin D deficiency. Adding a vitamin D supplement could help, and we can also look at incorporating foods rich in vitamin D, like fatty fish or fortified dairy products, into your diet. Now, regarding your testosterone levels, have you noticed any symptoms like decreased energy or changes in mood that might be related to that?
No, I've been told I should lift weights. I don't really want to take supplements in that regard.
That's a solid approach. Strength training can naturally boost testosterone level, and it's great for overall health. We can incorporate a structured weightlifting routine into your plan, focusing on compound movements like squats and deadlifts, which are particularly effective. How does that sound to you?
That sounds great. Also, I didn't discuss dementia with my doctor when I did my consult at Longevity Health. And my mom had dementia in her late 60s, and I'm concerned about that. I want to put something in my plan to sort of stay in front of that.
It's understandable to be concerned about dementia, especially with your family history. We can definitely add proactive strategies to your plan to support cognitive health. This could include activities like brain stimulating exercises, regular cognitive screenings, and mindfulness practices. Additionally, focusing on a diet rich in antioxidants and omega-3 fatty acids can be beneficial. How do you feel about incorporating these elements into your plan?
I'd love to put all that into my plan. And if you don't mind, doctor, I have to take another call. I'm going to call you back in about 20 minutes. Would that be okay?
I totally understand, but just a quick note, I can call you back. However, feel free to reach out whenever you're ready, and we can pick up right where we left off. Looking forward to continuing our conversation.
Sounds great. So you get the idea.
That is amazing.
And that's just our beta version. It's going to get a lot better. There'll be less
Wow.
latency and less pause, but it's getting better. So I just downloaded I just did all these tests and it's in my account. So this app, our AI chatbot has access to my private data, and it's analyzing the data that I just put in there. That's the first time I've called it. So I just uploaded it yesterday. So the
Wow.
master plan is to give hundreds of millions of people an account like that, $10 a month, and you can load in whatever data you want. Or based on your conversation with the chatbot and you talk about your family history, it'll recommend tests that are specific to you. And the problem right now in the marketplace is $8.5 billion has been raised in longevity venture funding in the last year. And a lot of it is for what I call McMedicine. And it's one-off tests where, hey, get this test, that test, hyperbaric oxygen chambers, DNA, RNA, all this stuff. They're all wonderful tests, but you really have to get tests specific to your goals. So when you talk to this AI agent, it's like talking to your doctor, okay? And the doctor will tell you, this is, Angel, this is what I think you should do based on your family history. The reason for AI is to reduce the cost of the physician doing all this upfront work, going to that useless appointment I had with the allergist. That's
Right.
where AI comes in, and then AI also comes in analyzing the data. Eventually, AI could replace your primary physician. It won't, but
Right.
check engine light comes on, you're going to be more prepared about your health than your doctor is. And when you walk into the doctor, hopefully he's going to be able to prescribe other tests.
Right.
So you don't have your insurance companies will pay for it, but your doctor will be much more informed. And you're already when you have an issue, you're all over ChatGPT and the web saying, well, you diagnose yourself with cancer by the time you're done with it. It's you know, but the idea is to help the physicians, not compete with the physicians. But I think in, I don't know, 3, 5 years, AI will prescribe medicine.
Nice. It's interesting how you said we're working in to work in conjunction with the physician because honestly, when you go, I'm just going from experience myself, and I'm just saying, you go to the doctor once a year and they don't, remember it's there's a lot of space in between that year. How are they going to remember everything, bring everything up? And a lot of times throughout the year, it's like, oh, this happened, but you forget about it by the time you get there. Where this really would help kind of be on track. And then taking the whole information in and say, hey, this is that can, and I'm just hearing, can this also be where can you asking the AI to say, hey, can you create a synopsis that I can take into the doctor to discuss? Is that also something that can happen with the AI, or is that something you're looking at doing? So what
Um,
you can use it in
thanks,
conjunction with?
thanks for the idea.
You're welcome.
No, that's easy to do. And eventually, like right now, we are our own medical practice. We have doctors, clinicians, we prescribe medicine. Um, the Eventually, where I see this going is you can give your doctor permission to have access to all or part of your records. So they can
Yeah,
just, before you even go in, they look at it like you do with, I don't know what medical facility you use, they have access to your records.
right. That's a really good way to do it. Just because honest, I mean, everybody's busy, everybody's doing everything to have the doctor have all the information instead of like, oh yeah, this happened how long ago, or you forget about it, having everything there. That's something key just for our own personal health to move ourselves forward where we're not forgetting some of those main things that we may forget in the moment. And a lot of people, they go to doctors, they get a little nervous, you forget about everything, and this way you'd have it in front of you. So I think that's a very key point to bring it together. And I love the fact that you have doctors, you have physicians, you're working in conjunction, creating all of this together. That's the most important thing. And a lot of people are looking for solutions of, I want to take more control of my health. I want to not fall into, like you had said, with family things, with different medical issues within families. How do I look at preventing that? And can I have that check engine light come on way sooner where maybe you may even be able to recognize things before they get to that point?
My wife has mild osteoporosis, so now we're going to the gym together because I need to beef up that testosterone, right? And but I think her doctor mentioned it to her like 15 years ago that you should be ahead of it, but she forgot, right?
Right.
Um, a friend of mine passed away, a woman with a lump on her breast, and she ignored it, ignored it, ignored it. But if she had some kind of, at the risk of saying coach, AI that was constantly reminding, gentle reminders like, hey, do this, do that, or go check on that. So that's sort of the concept is to build in that social element. But it's early. I mean, it's early because consumers are not fully ready for an AI doctor yet. We've tested it. They still want a human in the loop. And that's why we have this $11,000 clinic. And it's an incredible value. And I encourage anyone that can afford it to do it with us. We're developing a $6,000 product, and then we have a $2,500 check-in product. It has a little bit less physician work. So we're trying to make that more affordable. But you still need a doctor in the loop. I don't know if you have driverless cars in the Midwest yet, do you?
If they do, I haven't seen them yet.
Yeah, and
I'm
if you
sure they
do,
do.
when you see one for the first time, you're going to run. Okay. In San Francisco, they're safer than regular cab drivers. Like
Right.
everyone uses them. Like they're all over Waymo, and the but it took 3 or 4 years for adoption, and
Yeah.
consumers just aren't ready to give up the human element. And then AI, from a regulatory standpoint, is not fully ready
Right.
because it's just you can't prescribe medicine. There's, Congress and whoever has to look at it, right, and analyze it before it's, making health recommendations. And so consumers aren't fully ready. The regulatory environment's not fully ready, and AI is not ready. Everybody thinks AI is the be all end all. It's not because
It's
AI still hallucinates and makes mistakes.
And that's the biggest thing. And one of the things, so for those of you who don't know, I have a team in the non-physical. One of the things they have always been saying to me is everything out here, you use mindfulness, meditations, different things. That's and all different holistic areas. It's meant to be used in conjunction with modern medicine. We're meant to use it together. It's not meant to be one thing or the other, but to have everything flow together, to just reimagine our healthcare. And that's where we're at. We're reimagining it, what's going to work better for us because some things don't work, some things do work, but let's take the things that work and use them, let go of the things that don't, and start putting them together, reimagining what it can look like in the future because it is going to change and it needs to change. And there's a lot of good out there in all aspects. Don't they're laughing. One of the things someone else had always said is don't throw the baby out with the bathwater.
Yeah.
And that's where we're at, is bringing this all together. It's meant to be all used in conjunction, using the AI along the way, doing the specialized tests, meeting with a doctor, and then going, okay, this is what I've already done. Because the human brain is still hard to be replicated.
Very much.
And to know to bring all of that together is so important as we go forward. It's not a this or that, it's this and that. And I love the fact that you're starting to put different aspects together, using that AI, using the doctors, putting it together to reimagine that healthcare and to make it where people can access it at all times. Because I mean, honestly, there's a lot of times you try to get in and it's hard to get in for a while, especially specialists, very hard. But at least you'd have the comfort of knowing, okay, I can work with this AI coach until I see a specialist, and then I have more information to bring to the table. So I think it's a great way to work together with everything.
Thank you.
And that's something as you've been doing this, and I know you're in the beta stages of putting all of the AI, the coaching aspects together. What made you want to do the AI part of it? What was it about the AI to bring that together with the different testing, like you said, the billionaire bundle testing? Why did you want to bring them both together?
Good question. Again, not to replace the doctor, but we want to help reduce the cost of this so we can go further down market. I mean, like our program, the $11,000 program is an incredible value, but not everybody can afford it, right?
Right.
So AI can reduce the human element. Um,
And that's something important to know is, I mean, a lot of people, I'm just going to be totally honest here. My husband and I have a thing, we call it the 3-day no copay. If something's bothering us, we wait 3 days to see if it'll start taking care of itself on its own before we go any further with it and decide which direction to go with it because it is expensive to go in to see things. So it's like, can it be resolved? Is it resolving? Is there another way to handle it? Or, yeah, I need to go in.
yeah. Well, just having a conversation as we just did with the AI chatbot, it can, that can reduce an hour and a half of a doctor's time just to do the onboarding, right? You still need to have testing done. We still got to look at your medical records, which AI can do a lot of analysis, but it'll be a while before we take the human out of the loop. Um,
And that's going to be, and like you said, that's down the road, and I still think there's still going to be humans involved in all of this in some aspect because there's still, surgeries, casts, different things that need to be done that are going to involve definitely humans there. And like I said, the human mind, even though AI is really good, there's still aspects of the human mind they have not figured out, and I don't know if they're going to for quite some time. Because there's so much more going on with it. So, as you've been doing this, and this came from a lot with your family history and your dad passing away and other people in your family, have you noticed as you've been bringing people on, as they've been doing some of the testing within here, have you noticed people just feeling more confident in their own healthcare by using some of the aspects you have there?
100%. And I'm witness to it because I'm going through the program myself. and I knew I had some issues I had to deal with. They were kind of, buried. This brought it back to the attention, and then I'm getting solutions through our bundle program from our doctors to do things about it. And we've had, I don't have numbers in front of me, but we've had some great clinical results from the billionaire bundle where people have made behavioral changes and behavioral changes, diet changes, exercise changes, gotten in front of, diseases. In fact, I neglected to mention Jesse Levy, our co-founder and CEO, has a history of heart disease in his family. Not a medical doctor. He lost both his grandfathers, I think, in their 50s to heart disease. And that sort of piqued his interest. He started hacking, like a lot of people, biohacking, and said, there's a lot more than going to the doctor every year. I need to, do more testing. And as
Yeah.
I mentioned, the testings can be tested. We have our 6 tests that we do. We can vary the tests based on your conversation with the AI or the doctor that's specific to you. So yes, to answer your question, we've had wonderful results and feedback from our patients.
And I think it's really important, like you said, having that coaching and those nudges because people get busy and you're just like, oh, I'm feeling good. So you just let it slide and you don't pay attention. And having those gentle nudges, I think is really important. And I like how you said people are competitive. A lot of people are competitive where it's like, oh, I'm really close. I'm going to do those extra steps or I'm going to do this extra test maybe because that'll help me as I go forward. That competitiveness to use it to our advantage is important. And there's also something else that you talked about. You have the Charity of Choice Foundation. What is that about? What does that entail?
Okay, that's no longer. I folded that
Okay.
about 3 years ago. So that was my nonprofit engine for my nonprofit fundraising series, which was called
Mhm.
Echelon, where we focused on cancer fundraising for large cancer centers. So charity of choice. Initially, we did just charities for Livestrong. I'm sorry, cancer centers. Then I expanded it to all charities, and I built a platform very similar to GoFundMe.
Oh,
But
got it.
instead of charging charities 8%, we were charging a 0.5%. Very low
Right.
cost processing for the donations. And then we built a whole engine so you could join Charity of Choice and fundraise for your favorite charity, and you could attach it to any event or activity and build fundraising teams. And that's where I learned about gamification because when people get on a fundraising team, the money starts going through the roof, and it's like, hey, Angels raised $500 and Hunters raised $800. I want to get to my $800, right? So that's what
Got it.
Charity of Choice Foundation was all about. And I consider building a whole software company similar to GoFundMe, but it's a tough space. It's tough to offer nonprofit services because it's a Puritan world in the nonprofit space, and they all want everything for free.
Right.
That's a whole nother conversation. I have no issue with an expense ratio of a charity being high if they're doing great things with the money. But they have this thing about, oh no, we want everything free. We need to keep the cost down. So it's very difficult to get charities to sign on. And we're processing donations for a fraction of what they were paying, but it was they were kind of stuck in the mud. So that's what I did. But it was a great 15 years. We raised a ton of money and a lot of awareness, largely for cancer research.
Love it. And that's something important to know is, like you said, look at if people who are contributing to charities, just maybe look at what they're spending on, what their spending is there for. Where is it going? It's important to know. Like you said, it is a different world in putting all that together. But I commend you for all you've done to help all those different charities to bring it together, to bring that awareness out there. And you're still bringing awareness in all different ways, especially with the healthcare aspects. And as you go through with this, how do you see the future of medicine? What is your vision of the future of medicine in the next? Are you looking, and I should clarify, when are you hoping to get the AI $10 a month aspect out there? Is there a time frame on that? Is that something you're looking at? Is there a time frame or are you as it organically happens?
Well, right now we're adding to a small investment raise if anybody wants to donate to a startup. I say
Got
donate
it.
because many startups don't work.
Yeah.
I think we're going to build $1 trillion company and change the nature of preventive health. It's a 50, 100-year plan. Um, about the medical profession, where I see it going, I'm not, it's really largely just opinion. And I'm not super well versed in the medical profession to make uh, forecasts, but I think you're going to, it depends on how long our crazy man RFK is in office, but I think you're going to see a lot of changes with the causes um, of, the food supply. The drug companies, I hope, are more regulated. The food companies have too much power in Washington. Um, but I think in time you will see a system that's based on incentives and people taking actions to get better health care. It's a tough thing. Obamacare was sick care. Anybody that got on Obamacare got what there was no incentives to get healthy. There's a lot of people that can't get healthy that have, problems that they just can't resolve, and we need to help them and take care of them. But I think the healthcare system is going to become more incentives based. And there's a number of companies, including Paceline, who I work for, who's building an insurance effort around healthy, people following a better health regimen. So giving them incentives to be more healthy, right?
Right.
So I think you're going to see that the system change, but I think it's going to take a long, long time. From a scientific or a medical standpoint, I don't really know what's going to change. I do know that there are so many more tests out there today. It's a bit
Yes.
confusing. We don't know which ones to do, and everyone's trying to sell you on their test, and we're trying to debunk that by saying these are the tests you need. But I think in time, the insurance companies and uh, self-insured employers will start paying for additional testing out of their
Mm.
HSA accounts to keep people ahead of the health curve.
That's something really important is being proactive. I'm seeing, I feel there's a lot more companies that are going to be more proactive, keeping their employees healthier, finding ways to keep them healthier. And I love the fact where you're saying, you know, even having something when you get the beta process done and get it out into the public to have your coaching aspect, even for companies, to have that there for their employees. Because honestly, the healthier you are, the less medicine most of the time you need. And to be on that same wavelength with working to keep yourself better helps not only yourself but your family and where if you're working for someone or even have your own business, you're at work more, you're doing what you love, and you're not being taken down with everything else.
Right.
Because anytime you have a major illness or something going on, you forget about your health because everything's going fine until it's not. And once it's not, all of your energy, all of your time is just devoted to your health because a lot of times you put it on the back burner before and it's making you keep it on the front burner versus the back burner. That's the good thing with what you're doing.
To answer your first question, probably late November, early December, we should have a more comprehensive beta up, and we're going to do anywhere from a 200 to 500 user trial. So if people just go to longevityhealth.me and follow us, or my email address is hunter@longevityhealth.me. If they want to be part of that beta, I can send them. It's up and running now, but it's still a little bit wonky. I mean, it actually performed pretty well for you, but sometimes it hallucinates or it gets confused. Um, and then we're going to tie that into all the health records, which this beta version does. You saw that it reached out to my health records, but
Yes.
we have to make it just so easy to use, so user friendly. We have to train the LLM how to be a friendly person and almost like talking to your doctor. So
I
so
love that.
late December.
That's awesome. That's awesome. I think that's going to be perfect timing with this because, it is, I'm just hearing the new year, new ways of looking at things. That's where we're at. We're coming into that it's a whole new time frame. And honestly, time is speeding up right now. And it's a time to go, how can I get ahead of it? How can I keep ahead of it? How can I keep
Yep.
my own knowledge? And I know you've got to get going
New
nice.
year, yeah, new year, new you, except they drop off after February 1st. And that's our goal is to stay in front of you. So yeah, I do have a hard stop, but yeah, no, we would love if any of your listeners are interested in our existing program, our clinic. Check it out. I know it's not cheap, but it's game changing, life changing for some of our patients and for me so far. And then yeah, I really appreciate you having me on, um, and I look forward to seeing the podcast when it's out.
Absolutely. And I encourage everyone. And I'll just a quick question. I know I've got to get you out of here. When you have the $10, so they can go to your website, longevityhealth.me, and go on there. And then will that also be where you'll be announcing when the $10 or when the beta is out for the next step?
I'm not sure yet. Uh,
Okay.
I don't want to get tens of thousands of people on the beta trial.
Right.
So if people are really interested, they should just email me, hunter@longevityhealth.me, and I'm happy to invite them into the beta.
Awesome. That's a great way to do it. So, and I just want,
One other thing. The
yep.
beta, the $10 a month, the first one might be $200 a month. We have three choices around $200 a month, 399 a month, and 699 a month. And they come with human, so it'll be a slightly cheaper version of the billionaire bundle. The
Right.
$10 a month plan is probably 6 to 9 months out.
Got it. Good to
Um,
know.
yeah.
That's perfect. And that's for all of you here. Keep an eye on everything and check out longevityhealth.me and so much others. And I just want to thank you. I know I've got to get you out of here, Hunter. I want to thank you again for your time, for your knowledge, sharing everything today. I appreciate it so much. And for all of you out there, I want to make sure watch the next episodes of Edge Talk Radio. They are on the first and third Wednesdays of the month at 7 p.m. Central Standard Time. If you've missed any of the past episodes, no worries. Go ahead and check out any. They're on pretty much all the downloadable podcast areas. You can also watch it on my YouTube or Edge Magazine's YouTube channel. And I just want to thank everyone. And thank you, Hunter, for being here, and thank everyone for watching. Thank you all for watching, listening, expanding, and amplifying our universe together. I wish you all an absolute